can come out with out-of-box solutions. In companies like Google, which are known to be the best innovators, all employees have 20% time which is available to themselves, so they can come out with creative ideas. Talking about barriers to innovation, we are not into a risk-taking culture. We don't have a favorable intellectual property rights regime. In antibiotics, there have been a severe deficiency because there have been no major research or breakthroughs, because that treatment is not required for long term, and it doesn't make it a viable proposition. If the organizations develop one kind of antibiotic, the microorganisms reach resistance to that, so then they have to start afresh. So these are the barriers, some of the barriers in innovative process. And what are the attributes of innovation to be successful? Whenever we design some product or some process and we wish it to be successful and innovative, it should offer a certain relative advantage. It should be compatible with our values, beliefs, and of the potential adopter. So in healthcare, why the protocols or algorithms are not succeeding? Because the values of the physicians do not believe, they want them to believe in themselves. They say, we are in charge on the point of care, we have to deliver care, and we are accountable for that. So why should be bound by any cookbook recipe approach or clinical protocols? Similarly, any innovation has to be simple. If it is complex, then there could be problems. Then one should be able to try it. EMR, a lot of projects are failing because there's no experimentation or trialability in EMR. Once they are installed, once they are implemented, there's no going back. So these are some of the attributes of innovation or characteristics which make a product or a design to be successful. So we need to institutionalize innovation in our setup, in our departments. Like the day before, we heard Mr. Miles Eiling talking about the Department of Innovation in National Health Services. So the whole process has to be institutionalized. We need to cultivate it. We need to encourage it through right kind of people, cultural processes, partners, and networking. Then we can succeed to be an organization can claim itself to be innovative. So for that, we need right kind of policy work. Once an organization or nation chooses that it has to promote innovation, then it has to decide that it can import technologies, sign licenses, or go in for patents. So different countries have taken different routes. And the whole government policy should be favorable. There should be appropriate laws. And to give you an example, that our knowledge commission, our higher knowledge centers, they develop traditional knowledge digital libraries. So with, then they could claim that turmeric, cumin, ginger, and other such indigenous products are inventions of India. So an Italian company called Class Apps was filing a patent claim for them, so that patent claim could be thwarted, and Council of Scientific and Industrial Research could produce evidence, because our ancient literature, which has been in Sanskrit or Tamilian languages, was digitized and translated into modern languages. So government's role is of facilitator and innovator. It is performing...
please sum up.
Yes, sir. So when we say that everything is good about technology, there could be some cons also. I spoke about dehumanization yesterday, and now the innovation in Indian healthcare, what I believe is that there has not been enough of innovation in delivery and access of healthcare to reduce costs. We have a good market about disposables. We have friends sitting from the vendors. But when it comes to high-tech equipment in MRIs or CT scans, we still have to import them. And in healthcare, we have been lagging in innovation. We adopt a technology when most of them have adopted earlier, and we have been laggards in that. So delivering hospital and health services of future, we have to be innovator, or at least we should be an early adapter to the technology so that we can keep pace with it. Now coming to the pharma sector, any drug which can have health gains or which can benefit to the healthcare providers or patient convenience will be an innovative product. So those are the guidelines for pharma sector. In equipment sector, we have seen some changes in the recent past with companies like Opto Circuits and RFCL emerging, and government putting a proper regulatory framework in place so we can see good things happening. But along with the technology, there come certain side effects like increasing cost, as has been shown that as we have progressed from 16 slides to 320 slides CT scan, how the costs have got escalated. Now, when we talk about adoption of technology, we have to see what is the impact it has. So it's very convenient if we go by a matrix like this. If the cost is low and the impact is high, then there is no ambiguity in adoption of that kind of technology in healthcare. But if technology is for the sake of technology, then certainly we have to give it a thought. Now in healthcare there have been some good innovations, but there have been inappropriate technology applications also, like contraceptive implants, which have to be inserted and then removed. They didn't succeed. But then best innovation in healthcare, to give you an example, has been immunization, ORT. In pre-hospitalization care, we have heard about EMRI. In mobile healthcare, we heard about HMRI. We heard about telemedicine, daycare surgery. PPP models have been very successful. So as the healthcare is evolving, we need to have more innovative products and more disruptive innovations so that patients have not to travel far away and healthcare can be delivered in. So as the disruptions occur in point of provider, they will also happen in point of care. Will move towards the domiciliary care. And as the disease patterns become standardized, we'll realize that that kind of healthcare can be imparted by the paramedical staff as well. So this is a changing pattern of healthcare. From acute to it becomes chronic management, and from tertiary hospital care it becomes to a home-based care. And there is a great strategic opportunity in relaxing the role limitations, relaxing approval mechanisms. And I'll just give you one or two examples of innovation in healthcare. This is one person called Muruganathan who devised a sanitary napkin machine, and which can be widely used by rural women. And this is innovation, good example of innovation at grassroots level. Similarly, a rapid thrombocheck kit has been innovated by Dr. Dilip Srinivasan, which can assess the risk of cardiac operations. We have centers of innovation in our own country, like Jaipur Foot, which offers a very inexpensive food and which is being exported also, which has been a good example of ingenious innovation. So we need to emulate these models. A chairman mentioned about in the eye hospital. Not only it is doing the largest number of surgeries, it's exporting its lens, its cost is very low, and it has been a subject of study in Harvard Business School. Yesterday we had an issue of patient-centric care. We have now focus factories of heart care, and the Narayan Hrudyalaya is one example where the patient care is completely designed towards the patient. So to conclude, though healthcare is complex, innovation, like other industries, has a great role to play. Innovation enables treatment to be more effective, less expensive, and less risky, and of better quality. Less skilled caregivers can provide more effective treatment in more convenient settings. Healthcare organizations can make a strategic choice of innovative products, processes, and services and remain competitive. So my appeal is that in the liberal environment, let 1,000 ideas of science and technology bloom, and let these be transcreated into innovative ventures by one and all. I'd like to close with this slide of 3 idiots. Never try to be successful, seek excellence, and success will follow you, which I believe most of you must have voted. And thank you for your valuable time and patience listening. And thank you, Chairperson, sir.
Thank you.